Well done. Pop that inside your mouth. Nice tight lips. Really big breath in.
When you take a deep breath in, imagine someone strangling you and then just slowly crushing your windpipe.
16-year-old Rhys Connor's asthma is so severe, it has nearly killed him.
Felt like a really sharp pain on my chest on the left side, and then it gets worse and worse and worse. The pain gets more intense, and then eventually I just dropped to the floor, and I couldn't breathe anything, and I got rushed to hospital, and my mum was tapping my face, and I wasn't waking up at all. That's the one that stays in my head the most out of all of them.
When and where the air is polluted, Rhys knows about it immediately.
5 p.m. definitely, rush hour. Everyone's coming back from work or something, and it's just, yeah, it's not good.
And you feel that as a direct consequence of the 5 p.m. traffic?
Yeah, I would definitely say so. Definitely, 100%.
So I think the evidence is very clear that air pollution increases the risk that a child might get asthma in the first place. And for people who have asthma, prolonged exposure to air pollution can increase the risk of asthma attacks and make a child's symptoms worse, even when they're having a good day, even when they're well. So the impact is profound, and we know that severe asthma and air pollution can be a fatal mix.
New modelling from Imperial College London, commissioned by clean air campaigners and shown exclusively to Channel 4 News, reveals in detail never seen before air pollution across the entire UK. The numbers are stark. The model suggests the air at 70% of British addresses is so dirty it breaks current World Health Organization guidelines for 3 dangerous pollutants. 97% of addresses break at least one of these guidelines, according to the model.
There are places throughout the UK that have more localised air pollution than previously we'd expected. So people traditionally would associate air pollution with cities, but maybe they'll associate air pollution more with smaller towns and you know, more rural areas than previously they had.
Looks are deceptive. The green idyll of a bird reserve outside Leeds. Yet this new data shows many places like this could be toxic.
Do you think the air's nice around here?
Yeah. Yeah, I do.
It's actually really polluted.
Is it? Really? Oh, wow.
It does shock you to know that it is high considering where you're at.
That's a real concern, a real concern. I'm a driver in an electric car just to do my little bit.
The air we breathe is full of invisible microscopic particles which can be dangerous. PM 2.5 and PM 10 are minuscule, many times smaller than the width of a human hair. They come from cars and lorries, power stations, wood and coal burners. The reason they're dangerous is they can lodge deep inside our lungs. PM 2.5 are so small they can even make it into the bloodstream. Inhaling just a small amount can reduce life expectancy and cause lung and heart disease. Then there's nitrogen dioxide, which comes not just from cars and lorries, but also from the gas boilers in our homes. Prolonged exposure can reduce the capacity of a child's delicate growing lungs and also cause asthma attacks.
In the London smog of 1952, 4,000 people died within a few days.
The thick, choking smog that used to cling to many cities across the UK may be gone, but today's clearer picture still doesn't paint a healthy one.
So right here, we're breathing some of the worst, most polluted air in the UK.
Humphrey Mills was angry the public had so little access to air pollution data. He commissioned the new Imperial modelling and created a postcode checker so people could demand change.
The awareness levels of air pollution are so low that you've got parents pushing their babies and prams up 6-lane A roads. You've got kids playing in playgrounds or at schools on major arterial routes. You've got homes for the elderly and new housing projects being built on virtual motorways. And this is just being allowed to happen.
There's no doubt air pollution is falling, thanks to things like low emission zones and transition to net zero. And the government says it has ambitious plans to continue the reductions. But take PM 2.5. British proposals are still twice what the WHO now says is safe. as the evidence linking dirty air to poor health mounts.
This is the road that ultimately contributed to my late daughter getting asthma in the first place.
After Ella Kissy Deborah died from an asthma attack in 2013, she made grim legal history. Last year, a coroner ruled one of the causes was air pollution.
The government needs to take this matter very, very seriously, and the coroner was very clear. Unless the air is clean, more children like my daughter are going to die. We now know that air pollution is a public health crisis, and the reason why I say that, since Ella died, the number of children who die from asthma, that has not changed.
From London to Liverpool and beyond, and the many green spaces in between, new modelling suggests the UK is breaking World Health Organization air pollution guidelines on a massive scale.
Kami and Zoe. Well, we did ask for an interview with the Environment Secretary, but he wasn't available. So earlier I spoke to World Health Organization Director Dr. Maria Neira. I began by asking her whether Britain is unusually bad compared to other nations.
Well, first of all, we are very happy that there is such a monitoring and control of the air quality and information to the citizens. I think it's very important for them to know what are they breathing. Unfortunately, the levels are very high, that's true, but WHO recently produced a report where we're saying that almost 100% of the global population is breathing air that is not respecting the proposed standards by the World Health Organization.
I wonder why that message isn't getting through. I mean, I wonder why this should be news to people when they breathe this stuff and their kids are breathing this stuff every single day of their lives.
You are absolutely right. We need to do much more to make sure that everybody understands that the quality of the air we are breathing is important, that air pollution is causing more than 7 million premature deaths every year. This is taking quality of our life. This is costing a lot to the health system.
Over to you at the WHO. You've become very good at messaging in the last few years of pandemic. Why aren't you messaging more about this issue?
Well, I think we are doing it as much as we can. We are issuing these guidelines, the new guidelines, which are very ambitious, but are the ones that need to protect the health of the people. We are issuing information about the levels of air quality in the different cities around the world.
Fear worked pretty well in the pandemic to force us to do things that we wouldn't have done otherwise. So frighten us about this. Realistically, how bad is this for our health? What does it do to our bodies?
Well, it's very bad. It's affecting our respiratory system for sure. So causing lung cancer if you are exposed for a long time, or chronic obstructive pulmonary diseases, asthma, and of course they can now go to the bloodstream and then cause a stroke and cardiovascular problems. The issue in terms of public health is a real emergency.
Can you put a number to this? I mean, does the WHO have a number of how many people are killed around the world every year because of this?
Okay, 7 million premature deaths, 7 million people that are losing their life because they are exposed to these high levels of pollutants. In addition to that, you have millions of people's years of quality of life that they are losing because they have chronic diseases, but it's a kind of invisible killer.
So give us a checklist of 3 things that you think need to be done and done soon to bring that horrible number down.
Okay, keep informing people about those levels of air pollution because they need to protect themselves by putting pressure on the government. Stop burning fossil fuels immediately, as soon as possible. And then look at the traffic in your cities and go for a more sustainable public transport systems.
Where would you put the health crisis caused by pollution compared to all the other health crises facing planet Earth right now?
Well, clearly it's the biggest environmental health threat. So this is the environmental factor that is causing most damage to our health, and is certainly among the top 5 responsible for morbidity and mortality globally.
Dr. Maria Neira, thank you very much indeed.
Thank you.